It was just over a year ago that our government announced we would be refocusing Alberta's healthcare system, that we would establish 4 individual yet unified health agencies or pillars dedicated to delivering primary care, acute care, continuing care, and mental health and addiction services. We promised every Albertan, regardless of where they live in our province, access to the care they need, when and where they need it. I am proud of what we have accomplished in a relatively short period of time. I am also incredibly grateful to all who have contributed to this success. From the earliest days of this initiative, we've relied on Albertans and healthcare workers across the province to help guide us, and we made this deliberate decision to be flexible with timelines to ensure we get this incredibly complex and incredibly important work done right. I'm pleased to provide an update on this work today and say that the new system is taking shape. So this past July, the Ministry of Mental Health and Addiction stood up Recovery Alberta, and today Primary Care Alberta becomes a legal entity and officially begins its work under the leadership of CEO Dr. Kim Simmons, who is here today. Soon, these 2 provincial health agencies will be joined by the agency responsible for acute care, which will be known as Acute Care Alberta. Acute care is a significant part of the healthcare system, with complexities that require us to be thoughtful and intentional, so Albertans see tangible improvements to the healthcare delivery. Albertans deserve quicker access to care, reduced wait times for important surgeries that will benefit their health and quality of life, and to know that if and when they need emergency health services, it is there for them, no matter where they live. We want to get this work done right. The acute care system is complex, and making sure we set the system up for success now and into the future is critical. That's why we are shifting the timelines for when Acute Care Alberta will be operational. Early next year, Acute Care Alberta will become a legal entity and begin operations in early spring. While this is an adjustment to our initial timelines, providing Albertans with a healthcare system that is sustainable and effective remains our top priority. Establishing the Acute Care Provincial Health Agency will follow the phased approach that was used for Recovery Alberta and Primary Care Alberta. Alberta Health Services will continue to play a key role in delivering acute care services with a renewed focus on shorter wait times and higher quality care for patients. AHS and other healthcare providers, such as Covenant Health, will be accountable to the Acute Care Provincial Health Agency. And to support the stand-up and implementation of the Acute Care Provincial Health Agency and to ensure that essential services and the patient experience are not interrupted during the process, my department has also established a transition team. So this transition team will be comprised of executive members from Alberta Health, as well as an external special advisor, Dr. Chris Eagle, and Dr. Chris Eagle is here with us today. Dr. Eagle has significant experience supporting healthcare initiatives across Alberta, including his time as president and CEO of AHS from 2010 to 2013. That said, I want to also thank AHS President and CEO Athana Misalopoulos and the entire AHS board, chaired by Angela Fong, for their ongoing work towards this new vision. The continued leadership and dedication of AHS is critical to ensuring a successful stand-up of the acute care organization next year, and to the continued success of AHS as a valued healthcare provider. I mentioned earlier that as of today, Primary Care Alberta will be a legal entity, is a legal entity as of today. The immediate work will be to implement corporate policies and processes, develop operational plans, set Primary Care Alberta's vision and mission and performance targets, and work with stakeholders to meet the goal of ensuring every Albertan has access to high-quality primary care services so that they and their families are supported in their day-to-day health needs through every stage of life. As our new healthcare system takes shape, it's important that Albertans understand and connect with the agencies that will be leading the charge of change. That's why today we are also pleased to be unveiling the new logos for both Primary Care Alberta and Acute Care Alberta, which you can see behind me. Each provincial health agency will have new and distinct yet complementary brands. Cohesive colours among the provincial health agency logos reflect our commitment to fostering integration within a unified and refocused healthcare system, while the distinctions between each brand highlight the unique qualities of each agency and reaffirm our promise for a new direction for healthcare. A brand is more than its logo. It reflects each provincial health agency's intent and promise of what it will achieve for Albertans. Primary Care Alberta is the first step to a healthier future. By delivering accessible services and coordinating resources, it will help prevent illness, promote well-being, and enhance quality of life for all Albertans. Primary Care Alberta's branding uses connectivity to communicate a team-based care model. It reinforces care and compassion and puts the patient at the center of the care. And it represents the diversity of healthcare professionals under the Primary Care Alberta umbrella. Pardon me. By improving access, empowering healthcare professionals, and being transparent, every Albertan will get the high-quality, timely treatment they need during emergencies and for serious illnesses. And through unique branding for Acute Care Alberta, we hope to increase awareness so we can all better understand when to use acute care services instead of primary care services. We will keep Albertans up to date as the work to stand up the Acute Care Provincial Health Agency continues. In the meantime, there will be no disruption to service. Albertans will continue to access acute care services as they always have. And healthcare workers will continue to provide that same exceptional care. In addition to these updates, we're also taking a more integrated approach to the health system planning to inform provincial and local decision-making and better respond to the needs of Albertans. We are going to do this by transitioning from 5 standalone regional health zones to 7 integrated health corridors, whereby we will make better informed decisions about services, workforce, and infrastructure. Because the new corridors reflect where Albertans are accessing care, we will be better able to determine existing gaps in the healthcare system and where investments, including operational dollars and funding for capital projects, should be allocated. Lastly, I want to emphasize that engaging with healthcare professionals, patients, and all Albertans has been and remains vital to our work to refocus the healthcare system. I encourage all Albertans to participate in upcoming telephone town halls where we will be discussing the ongoing work. Our next telephone town hall is tomorrow morning, and 2 more are scheduled for November 27th and 28th. You can register at alberta.ca/leadtheway. Again, alberta.ca/leadtheway. I also encourage you to provide feedback through an online form until December 5th and to sign up for an e-newsletter that will keep you up to date on the healthcare system refocusing work. A second round of in-person public engagement is planned for early 2025 to share information and to receive feedback on our ongoing refocusing work. Over the past year, I've witnessed the passion, the dedication, and tireless work of our healthcare workers and allied healthcare professionals right across our great province of Alberta. A record-breaking 304,500 surgeries were performed last year. That's the most Alberta has ever done in a single year, with expansions to operating rooms in 19 different communities to boost surgical capacity. This year, we are on track to surpass that amount to nearly 310,000 surgeries. I also want to share that as of November 1st of 2024, AHS has already completed approximately 9% more cancer surgeries compared to the same time last year. For the second consecutive year, A record number of registrants renewed their permits with the College of Registered Nurses of Alberta to continue practicing in Alberta. So over 44,798 registrants are now practicing, and there was an 11% increase in renewals for RNs and 15% increase for nurse practitioners. Finally, at the end of September, there were 12,126 physicians registered in Alberta, an increase of 518 physicians compared to the same time last year. We have also seen a 5% increase in the number of family physicians over the same period. So these record numbers reflect that there are more doctors registered in Alberta today than at any other time in the province's history. I am very encouraged by what I'm seeing, and that is why we have committed to continuing our refocusing work and reaching the finish line so we have a healthcare system that truly works for all Albertans and for all healthcare workers as well, not just for now, but for many generations to come.